Prion disease is usually sort of a universally fatal. It's not treatable.
What are the treatment options currently available for patients with Prion diseases, and how effective do you feel are they in altering the disease progression?
Disease is universally fatal. It's not treatable. And when we say it's not treatable, it's not treatable in terms of curability. It's not curable. What we can offer to the patient is little bit of symptomatic treatment for seizures, for myoclonic jerks. Otherwise, the disease is rapidly progressive. There is no cure, and we know ultimately the patient will have mortality. But what is important is that Prion disease is very rare condition, and it's sort of a chameleon. It's a great predator. It has a number of differentials. So whenever we consider the possibility of Prion disease, we first consider other diseases which are more common and which can have similar presentation, which can even have similar age or MRI findings. So we tend to rule out those more common diseases first, and once they are ruled out, and then only we go for the testing for Prion diseases. So for example, if the patient with 55 or 60 years of age presents to us with rapidly progressive dementia, then we do need to rule out neuroinfections. We need to rule out any autoimmune or paraneoplastic encephalitis, and we do need to look at the MRI findings if there is a cortical dribbling sign or there is some other structural lesion sitting over there. So Prion disease is usually sort of a diagnosis of exclusion in a way that we first try to exclude the more common and the treatable conditions, and that is what is important. So we can't just label a patient with a probable CGD just like that. We need to rule out the alternate diagnosis, and that is what the diagnostic criteria also says. The diagnostic criteria mentions very clearly that all the alternate diagnoses have been ruled out, and that means we have worked up all other etiologies.